Welcome to the CodeCast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the CodeCast podcast today. My name is Terry Fletcher. So since we are in a holiday week that I'm recording, you're probably hearing this, actually you are probably hearing this on the 9th of July, but I record before that. I wanted to keep it kind of short and sweet. I know everyone's probably out of town or not listening to a lot of these, so this is just a short one today. We've had some alerts come out as far as July 1st. We are now dealing with some NCCI edits for caregiver training, prolonged service codes, etc. So if you haven't seen the update, I know sometimes in the summer they slide these things by us. What this NCCI is, it's National Correct Coding Initiative Update. So if your practice misses the procedure to procedure and medically unlikely edits, so PTPs and MUEs that go into effect July 1st, you could spend the rest of your summer dealing with some denials, and I don't want you to do that. And so first, the update is 926 new and 292 deleted and 2 revised PTP edits. So remember, that's procedure to procedure. Then the medically unlikely edits contain 27 new, 30 deleted, and 21 revised edits. So what these edits are, procedure to procedure, first is when you see a PTP edit, what that means is that those are defined pairs of HCPCS and CPT codes that providers shouldn't report together for various reasons. So PTP edits prevent improper payments when you report incorrect code combinations. So each edit has a column 1 and a column 2 HCPCS or CPT code. So one tells you that you shouldn't use this column with that column. And so you have to be very mindful of that. When you look at MUEs, MUEs are medically unlikely edits. So what that means is that how many of that particular code can you actually do on a given calendar date, so per date. A lot of people thought it was per encounter or per session. It's per date. And so you have to be very mindful of those things, especially, I'm thinking debridements or when you remove lesions or polyps, or when you try to bill for services that you're thinking a 59 modifier will help, but if it's got a PTP edit, it may not. So just looking at the highlights here, CMS will bundle 2 blood collection and 1 irrigation of drug delivery system into functional performance caregiver training codes. So those new codes, 97550 to start, those now are included with some of, again, the blood collection and the drug delivery system. They don't want you to get too much reimbursement on that, because those are really for performances in the patient's home to help facilitate their activities of daily living and some things that they need to do for motility, mobility, communication, patients that have swallowing, feeding, problems, safety practices. And so those are important codes to understand. So 97550 to 97552. And look those up, because if you have a qualified caregiver that's really getting training in these services, community services for patients, then it's something you want to embrace as far as something you could possibly report. Effective July 1st, 36591, collection of blood specimen from completely implantable venous access device, or 36592, same thing but from a central catheter, and irrigation of that device. Those are now bundled also in caregiver training codes. And when you have an indicator of 0, remember that's what's on the PTP edits. It means you can't use a 59 or an X modifier to unbundle and receive payment for both services on the same day. If you try to do that, it will spark you for an audit, probably TP. I would say probably TPE, but most likely a CERT audit. If you have private payers that cover non-face-to-face prolonged service code 99358, which not many do, be aware that the PTP update will bundle the interprofessional codes, if anyone is using the 99452s, with those edits. So with those non-face-to-face prolonged service codes. So just be aware that those are not going to be allowed together. You can't pair those together. Just some kind of updates I'm noticing that people are starting to use. Also, the code 99494, initial and subsequent psychiatric collaborative care management, those are 30 calendar day months. Those are behavioral health services and activities. They now have MUEs that will be going into effect. And they did expand that MUE. Used to be 1, and now they kept the adjudicator of 3, so you can actually appeal if you're getting any denials on those. So keep those things in mind. But I just wanted to bring that to your attention. That's not all of them, because since I told you there's hundreds of additions and changes, but you never want to miss looking up your NCCI edits, because all of a sudden you may have been getting paid for something, and then you look up something and say, why, or you get a denial and think, why am I getting a denial now? Well, you could have had an adjustment in either your MUEs or your PTP edits, which means now they're bundling things. And you want to be very consistent that you're not then transferring that to the patient, or you're just not, aware of what the new update is. There's also been something that's come up recently as far as, are you allowed to charge for no-shows? And, it's controversial. It's also, in my opinion, kind of a moral decision, not just a financial decision. So I see some offices, and I've even got some clients that are charging $50 to a patient if they miss an appointment to help reduce no-shows. I totally understand that. But there's a lot of patients that refuse to pay it, and then your provider wants to send those to collections. Now, if you're Medicare, you can't do that, okay? So administrative fees and medical practices, that you can't add charges to fees for medical treatment. Can you charge patients directly for no-showing? Yes, you can, but can you try to get the payers to pay? That's up to your contract. So as far as Medicare, don't even try it, because that'll just come back to get you. Medicare pays for face-to-face services. And the other thing is that there's issues as far as firing patients or abandoning patients at no-shows, and you'd have to get some legal insight into that. You have to do some kind of deterrent for sure, so that you don't have to send them a collection, because once you send them a collection, you get into all kinds of things. Now you've possibly put a mark on their credit. They go to try and buy a house or try to be credit worthy and try to get something, and now it's not a medical bill, it's an administrative fee, and that could really come back to get you. You don't want to do that. And CMS policies, they do allow physicians and suppliers to charge Medicare beneficiaries for missed appointments, but here's the thing, you have to be very careful, because you cannot discriminate against Medicare beneficiaries and then also charge non-Medicare for missed appointments and so on. So you have to apply your policy on that straight across the board, but Medicare in some states actually forbid these kinds of charges. So Medicaid, for example, in California, Florida, New York, and Texas, they interpret the Medicaid law, specifically Section 447.15, say acceptance of state Medicaid payment is payment in full, and they cannot bill for no-shows. So you can say if a patient continues to no-show for several encounters, you can write a letter to their Medicaid provider and say, hey, they've got coverage and they're not showing, and we're keeping this open and it's costing the practice money. So I don't want to say there's a way around it. I hate that phrase, but there is a way to make sure the patient is alerted without getting yourself in trouble for charging things. You also have the thing about the No Surprise Act, and to try and charge, patients for, again, administrative, that's considered administrative services, not medical services. So you really want to look at your state first before you decide you're going to do that. And then look at your licensing board comes into question. And then just know patients will just love to not only complain, but file a complaint against you. So really make sure you have not only the position of your state, if they allow it, the patient's payer if they allow it, and then I would get a legal position as well and see if they allow it. So I'm not saying you can't do that, but I can just say, because I'm seeing that doctor's appointment missed doctor's appointments, our fees are on the rise. But can you actually do it? It really depends what your state is saying, etc. So just be aware that it is not just a blanket yes or no, can you do that? Okay, well, that's going to be it for me today. I hope everyone had a nice 4th of July holiday. We just watched baseball, spent some time in the pool, of course, barbecued, and watched some fireworks. I love fireworks. That's my favorite thing to do. And so it was one of my favorite holidays. Of course, we hit 100 degrees, so it was very hot. So those of you, I hope you have air conditioning or found a way to stay at least comfortable in the heat we're experiencing right now. I know we're right in the thick of summer, so we've got a couple more months of this, but everyone have a good rest of your week. Make it a great day, and thank you for listening to the CodeCast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.